off. I can't see my phone.
All right, Hal, I'm already.
Yeah.
I already turned it up, so we're already live. So we'll wait here just a second, let a few people get on. But you and I have been at the same meeting, so where we actually got to meet in a room with people, all spread out. But it was a different feeling than what we've been used to.
Yeah, I'm not. I wasn't used to it. So it was kind of nice to have people in the same room with you.
I know, and when you go by people, it's like I can't shake hands. Hey, I'll just wave at you from a distance. So it's a little something we're going to have to get used to. So
Yeah. So yeah.
But I know you and your team has been extremely busy, and gosh, just over how long has this been now? 5 weeks? Is this
30? We're on day 36 actually from our first positive in Sumner County.
Well, and again, I don't think you guys have stopped. You have been full force, because I think what people don't realize is that when you guys come in and you're testing from, say, 8:30 to 3 o'clock, there's a lot of other things that goes on besides testing. So you want to talk a little bit about what all it involves?
Well, after all the, what happens with your test results and those samples is getting them prepped, ready to go to the lab. There's quite a bit of work, and we go through and check, make sure the right paperwork is with the right tube, and make sure that is properly sealed. And then what we're doing with them is putting them on ice and make sure they get they're the right temperature. They need to be chilled down some before they go to the laboratory. The lab picks them up that afternoon, takes them in, and then overnight the laboratory crew gets to work and pulls those samples out and does their thing. And usually within we're right now I'm tickled. We're about 48 hours out. We can get the results back. We've really sped up our lab capabilities statewide. So we're able to get those results back.
And I think that was a lot of the difficulty in the beginning, is a test was taking 7 to 10 days sometimes to actually come back. And I don't know that the health department's numbers were that long, but the private side was that long on getting information back. And then, of course, you had less tests. You didn't have as many tests available, so you weren't testing everybody. How has the number of tests and what you do, how has that improved, and what are you seeing in the availability?
Right now in Sumner County and all the county school except the metros, we're testing anyone who wants to be tested. At first we were just testing symptomatic or individuals we knew who were contacts with positives. We've gone to just testing anyone in the public now. And of course, with those, our numbers are the number of tests are given have significantly gone up, but the positive rates have dropped, which is good news.
Yes, and I know I was in a meeting with you earlier, and you discussed on your Sunday. You never know when these pop-up stations, how well they're going to be received, how much you're going to find that people are utilizing those services. But Sunday, you had a huge turnout for your drive-by testing. You want to talk a little bit about that?
Yeah. We had 9 to noon on Sunday at Gallatin High School. We had 820 individuals that we tested. We were the largest per hour rate site in the state. Some others did larger numbers, but they did a longer period of time, 7 to 8 hours. We had 3 hours. We tested more people in 3 hours than some people did in 6 and 7 hours. And I was really tickled with the flow and the turnout. The staff did excellent. We had National Guard come in, and they helped tremendously in getting that numbers and that data back. I was really pleased with that.
How many staff members did you have there being able to actually perform the test?
We ended up with about 28 National Guard there that day, and 23 of my staff were there. So that was a team of close to 50 or so, and to get that many in and out. But we were really, really tickled with how the flow went, and the National Guard said we had our setup and our flow was the best they had seen so far.
That's awesome. And I know, like I say, I know your guys are exhausted because you have been working nonstop to kind of keep our numbers under control. Get data. That's what a lot of this comes back to, is having the data, and the testing comes back to helping that as well. I have a question here from somebody. It says, "Do you know the numbers from this past weekend? We test so many. So are all of those in, or a portion of those in?"
All of those in. We had 20 on that Sunday. We had 25 that were positive.
And also you can give them information about where these people were coming from.
Yeah, we had now state of Tennessee. We were testing anybody and everybody. So we had Kentucky, we had Robertson County, we had Davidson County, we had Wilson County, we had Macon County. On Saturday, I know that my counterparts in Robertson and Wilson saw Sumner County people there. So when if Sunday wasn't a good day for you, I know we had some Sumner County people to go to Robertson, to Wilson County, and we've even had a few to head up to Macon County to get tested. They had tests on Saturday, and we had ours on Sunday.
Well, and I believe Robertson County, have they been doing that drive-through every day?
Yeah, they're at the fairground every day doing their testing. And they've had real good numbers every day.
We're very fortunate in Portland to have a Sumner County Health Department. It is due to the large size of our county that having a station in Portland is really very beneficial. And you're doing testing there as well. So Monday through Friday, you're doing testing there from what time?
9 to 3 every day. We'll probably continue that definitely this week. And schedule it all next week, 9 to 3. You can call the health department at 615-325-5237, or if you will just pull in, you'll see the signs, pull up to the cones. There is a marker right there with a cell phone number in front of the cones. You can call, give them the information. The nurse will come out and get a swab tissue from you, and you're good to go.
So, with this information, so are you taking insurance information and filing insurance with this as well?
No, this is all free. There's no cost to it. There's a few research questions, background questions. Are you symptomatic? Have you been in contact with a positive? Just some information along those lines. Takes less than 5 minutes to get your name, address, phone number, just that background information, and out they come, and away you go.
Well, and it can't take much longer than 5 minutes for y'all to go through over 800 people in just 9 to 12. So again, that's just very efficient, and I can see why they said that. It's funny on here. Caleb is one of our chamber members, and his statement is, "I did not know we had a health department in Portland." So.
West Longview Drive. We're on we say we're on the hill behind the hospital. So
that's right. Yes. So it is, and it's not been there. How many years now?
Actually, we're going on 10 years.
10 years. Yes. So, in the same building too. Is that right?
Yeah. Yes.
Yes. So, because I remember when it was built. So, it doesn't seem like 10 years ago, but I guess it was.
Yeah.
So with these numbers that you're seeing, and I know your staff is stressed. They're having to deal with a lot of things that we as the general public don't have. They know that they're coming in contact with people every day that are asymptomatic or that have been tested positive for the virus. So how is their morale, and how are they doing with just that side of what's going on with them?
Well, this is what we love, because this is public health, and this is one of the things that all the staff that are here, we really kind of, I don't want to say we live for, but that it's just basic public health, and it's one of the things that the Department of Health does. And we're talking that we're ready for June and July, which is usually our time when we're doing a lot of physicals, a lot of immunizations, and getting kids back to school, getting ready for the school year, and lots of birth certificates, death certificates, and we're already thinking, all right, how is going to affect that, and getting our plans together and getting our ducks in a row so we're ready to take care of that. But now, one of the great things is we've had about every other day a civic group or individuals or businesses have just dropped by some of the clinics and said, "Here's lunch," or "Here's cookies," or "Here's some desserts," or so. And we're having to. I'm thinking I'm gaining weight during this period of time because all the goodies and food dropped off. So it's been just the community coming and thanking us, and that was one of the things that the staff was really brought to my attention Sunday. The number of people that kept saying thank you, thank you, thank you Sunday that after they were tested.
Well, you're a little bit like a fire department. Nobody really thinks a lot about the fire department until you have a fire. So
Right.
until you need your services, you don't think a lot about an ambulance until you're needing to be transported somewhere in an ambulance. So, knowing that the health department's there is a security for us. But now we're all realizing the importance of that health department. So,
Yeah. When there's no food
and
outbreaks or disease outbreaks, which we've historically we've done our job and we've done it well. And then this is one of those things, and it's new to every one of us. So it's something different. We had prepared for it through our disaster preparedness, and but the virus in was something new, and I think we've adjusted quite well.
well, it's like anything else. You can prepare for the unknown, but until it's here, you really don't know. And this could have come out in any matter of form, or could have been something different. So let's get off of the whole COVID for just a moment. And how long have you been the director of the health department?
Uh, just going on a little over 10 years now.
Okay, so you built the health department in Portland. There you
Right.
go.
Yeah. Mary Howard Hayes we had the building completed, opened up in the spring, and she retired in late summer, and then I took over in January of that fall. So,
Okay.
so she actually got the pleasure of that
The
work,
credit.
getting it all that done. Yes, ma'am. She got that done. And,
But she also had the build, which is probably a very big headache too. So
oh yeah, and going through the state contracts and working with the county and the
yes,
state at the same time, and all. But I laugh and say having that third building is like having a second or third child. It's 4 times the work.
yes.
Making sure your staff is covered and the bills are paid and everything's taken care of in the building. So we're only one of 2 counties in the state that's got 3 health department clinics in the county.
Oh, that's great. And so for the clinic there in Portland, and I say there because I'm sitting in my house, so I'm not actually at the office, so it makes it a little different. So the clinic there, what is typically the services that people are coming in to receive before COVID-19?
Well, we take care of all the underinsured and uninsured. Also, one of our big programs, especially in Portland, is our WIC program, the Women, Infant, and Children. It's a food supplemental program. Um, I just hired a nurse practitioner, Piper Hammond, who has been with us about a little, just over a month and a half. I said, "Welcome to public health," and 2 weeks into being released after her training, she is now going to be a COVID-19 veteran. She's in Portland 3 days a week, and she goes to Hendersonville 2 days a week. So we've got a nurse practitioner there 3 days a week, plus, of course, immunizations and child physicals, and then what we call the old-fashioned public health, the communicable diseases. And again, the immunizations is a big program for us too.
And I think one of the good things that people may not realize, because you don't need these every day, is your birth certificates, as you were saying. If we need a birth certificate, it's great access to be able to go and have that printed right there.
Yes, right there in Portland. Don't have to come all the way to Gallatin as you used to. What we found out in the last 10 years, is that once Portland was built, we were actually building it to relieve some of the numbers and the staff, um, the population down here. What we came to find out is that we were getting all new patients in Hendersonville who'd never been a health department patient. Um, and this was just prior to the completion of the 109 extension. And of course, people didn't want to come down the ridge. So, we were tickled to find out that we had a whole new uh, group of patients in Portland that we could now serve.
Well, and I do think it's very important that people realize that when I was growing up, that is where we went to get our immunizations. A lot of kids now will get them from their primary care doctors. So you probably don't have as much as at one time you did, but I do feel like that a lot of that is knowledge. I think people don't realize the services that they can go get there, just like your even just the birth certificate, just being that convenient to be able to go and get a birth certificate. Again, you don't need them every day, but usually you don't have a lot of warning when you do need that birth certificate. And I guess people are needing those more since the star on the license has come out.
Right. That's picked up quite a bit with the star, needing the birth certificate, needing an embossed copy. A lot of people may have a copy, but not the official copy. That, and if you've got a child going into Sumner County schools this fall, you need to make sure you go ahead and plan on getting one today. Don't put that off, because we'll do our business really picks up about the 15th of July through school start, and asking people to think about go ahead and get your birth certificates sooner than later.
A couple of questions on here. Is Portland doing anything unique to try to reopen, and what can we expect come May 1st? It just so happens we were just at a meeting that we had a lot of discussion, but it's still in planning stages. And we're trying to be cohesive with the county. So I feel like that the county is trying to come to this under the same direction. And that's why we pulled all the mayors and you together. Do you want to speak on what we talked about any today?
Yeah, we've come together today and spoke, and we're getting our plan together so that May 1, when we do open, that no matter what city, municipality you're at or in the county, we're going to be all under the same guidelines, same rules. So our verbiage and the request are the same. It's uniform, and that's for everybody's convenience. But let's go ahead and think May 1 doesn't just end COVID-19.
Right.
What we're doing, the governor and local leadership is doing is just relaxing some of the rules. We've done a really good job of stopping the spread, but we need to really think about, continuing that at least through the month of May at the very minimum. We could turn around tomorrow and our numbers spike, and it doesn't take but just a few minutes with an individual that you could spread the COVID-19 virus, and then they spread it, and then they spread it, and then we're back to where we were a few weeks ago with the numbers just dramatically increasing every day.
Well, and one thing that we talked about is we're really still waiting on that direction from the governor, because he has the first say. So we really are waiting for that. My understanding, in the next 24 to 48 hours, we're supposed to have his guidelines and his packet of information. Is that correct?
Yeah, he'll put out the guidelines, and we'll follow slightly, seeing that we are one of the leading COVID-19 counties in the state. Some guidelines that I want to see if we can drop our numbers dramatically in the next 2 or 3 weeks and move from behind Shelby and Davidson County. Let's see if we can slide down the line a little bit and really knock out or stop that spread.
Also, I think somebody wants to know about the parks opening. So I believe the walking trails are open. The golf course is looking to open. I know a lot of golf courses have been opened, but I think Portland has had theirs closed, and they're looking to open that with some restrictions and some guidelines. And here's what we have to realize: if we follow the suggestions and the recommendations, the sooner we're going to be able to get back to phase two and then phase three. And I think that for the most part, people are willing to follow those guidelines, but that is something that I think they're looking for. They'd like a little guidance.
Yeah,
So
we're going
go
to
ahead.
take this one step at a time. This phase one should go through May 15th, and we'll reevaluate closer to May 15th to see how our numbers are. If we've curtailed the spread, and then we can move to phase two, and then on. And each phase is a little less restrictive, a little more opening of business and activities in the communities.
Well, and I feel like that everybody wants to get back to normal, but they also want to be safe. So I think in doing it in this phased manner, we'll be able to see what's going to cause these spikes and where the spikes are happening. I know that there's a lot of data out there, and what we get to see is the Sumner County data. But as the health department, you guys have a little bit more of the data that you can't share due to HIPAA and things like that. That you can kind of watch some things that we don't know about.
Yeah, we will have a little more awareness about locations and spots and what we call clusters or cluster outbreaks, and the staff are monitoring those groups, and and that's what we want to in the next 2 weeks is really going to spend a lot of time at those investigating and researching and finding those cluster outbreaks and trying to stop that spread. Um, the one of the nasty things about this COVID-19 is you're asymptomatic and you could be um, could be spreading the disease and you not know it. So again, we're really encouraging everyone to wear masks in public, limit your time in public. If you even the next 2 weeks, if you don't need to be out, don't go. Um, Wear your mask. And again, one of the best things to do, wash your hands multiple times in and out. Use sanitizer. I've got to the habit when I get in my truck, I sanitize. And when I step out of my truck, I sanitize. And anything I pick up, um, whether I'm making the deposit at the bank, I'll sanitize after I get that and put it in the envelope or in the mail bag and wipe it down. I'm just being cautious and being aware. So
My son works at Discount Tire, and they have this wash your hands, wash your hands, wash your hands. So he's washing his hands. Well, all growing up, he hated lotion. He hated lotion no matter what. And he comes in and his hands are like completely red. And he's saying, "Oh, my hands are killing me. What's wrong?" And I said, "You need to put some lotion on." I said, "So, they're actually washing hands more than they're using sanitizer," which I think that as long as that's available, that's the way to go, is to wash your hands and to wash them in the correct way. But it still does dry your hands out and it still does make it difficult. So we do need to make sure that we moisturize those areas too, because I mean, it is painful when that skin starts cracking.
yeah, so and this time of year is Tennessee allergy season. Got to be aware of that. And again, if you feel bad, if you are running a fever at all, stay home from work, stay away from others. Come to the health departments or your primary care provider, get tested. Uh, that's how we're going to stop this thing is getting out and being aware and get ourselves tested.
So we have a question. Are we now able to see the breakdown by zip code for COVID-19 in Sumner County? And where is that information located on the web? I don't believe we can see that. Is that correct?
There's some new data that's going to be released today or tomorrow by the Tennessee Department of Health. I don't know if it's going to be today with the governor's afternoon meeting, his phone call or his news conference. But there's some new set of data coming out that should be uh, very enlightening, and I believe it may include some zip code information.
Okay, that'd be great. I know people are concerned about it, but in the grand scheme of things, and true, we just need to be prepared and know that there's a chance we're coming in contact with somebody. So you take all the precautions, and that's really the best way to do it. But it does make you feel a little bit better if you do have numbers. We all like numbers.
Oh yeah, yeah, and that's the thing. That's why we want to get more people tested so we can do some the data analysis, community research. If I know more, more numbers in a specific area, um, then we'll feel better about the outcome.
We have somebody asking about hair and nail shops. When are they going to open? So can you address that?
That is part of the governor's plan. He'll be uh, releasing that information, and I believe the county mayors and I will be releasing our information, our I don't want to say protocol, but our recommendations along with the governor's recommendations, uh, possibly at the end of the week, first of next week.
And I think that the intent is if everything goes, is May 1st is still kind of what they're looking at the moment.
Yeah, May
And
1st is kind of the kickoff, come back, open up. But again, it's going to be in phases. We want to walk before we run. We don't want to have a turnaround, and in 2 weeks our numbers are spiking, and we're back where we were 3 weeks ago. We going to go through this slowly, and again, in life, it's going to be common sense: keeping your
right.
hands washed, keeping your face covered, limiting your exposure to the public. You made a statement a minute ago, and it said you never know who could be a positive in walking around you. You know who's carrying this virus around. So something to be aware of every time you go out the door.
And I do want people to know when we do get the word and get the go ahead to open our hair and nail shops, there's going to be recommendations to help keep that spread down. We don't really want people waiting in lobbies, and we don't want extra people in there. If you don't want you to bring your children into the hair salon and the nail salon, because again, we're trying to limit the number of people. So there's going to be a lot of suggestions and recommendations on that. And you as a hairstylist or as a nail tech, you don't want to be exposed to any more people than you have to.
Right. It goes both ways. I mean, you want people to stay away from you, and you want to stay away from individuals, but you want to do business. So there's going to be some it's not going to be business as normal right now. We're going to really walk before we run, and try to limit your exposure, your um, hazards to a potential positive individual, and the public needs to do the same.
And somebody says, are there businesses that will not open on May 1st? And I think that's to be determined. I think they're coming up with that list, and they're still, again, it's something that we've been waiting for the governor's response on a lot of this for the week now. So hopefully in the next couple of days, we'll be able to have that information and have a little bit more knowledge.
And just look at the bright side is it'll be actually 6 weeks from when the stay at home started. We've done a great job so far, and we're going to try to get back to normal, back to business. We just need another 2 to 3, 4 weeks more, and again, this phase one to go through May 15th and see how we're doing. But worst case scenario, can you imagine if we're still on the increase and still in bad numbers, where it could be up into July before we were back to somewhat normal. So, I mean, my hats off to Sumner County residents. We've done a great job. We've weathered a bad storm, but we just need to stay calm and be smart for another couple of weeks, and fight through this a few more days.
Another question is, are we planning for a second wave during the flu season? Is there a concern for a double whammy of the COVID-19 and the flu? And is Portland prepared? So you want to address that?
Yeah, well, we're going to see after the stay at home is resolved and people are out and about. We know that sometime in the month of May or early June, we're going to see an uptick in the state, either locally, hopefully not locally, but statewide and nationwide, and what they're going to call the second phase. I've also heard the medical experts say that come fall, we could see another increase or, in COVID-19. One of my hopes is that generally in the Tennessee, less than 50% of the population gets a flu shot. I'm hoping that we can blow that out of the water this fall, and we have, can get 75 to 80% of Tennesseans to get a flu shot. That would be a tremendous increase and just another way to protect ourselves. I'm curious to see how the public reacts, and I'm hoping we will. I mean, it's a smart thing to do.
It is, and I know a lot of people are looking at this a little different now than they did at one time. And I think maybe people that had not gotten a flu shot in the past are maybe thinking, it might not be a bad idea to get one of those, because it's not only the COVID-19, but we've got to really stop the spread of all of these viruses that could potentially cause harm or death to our citizens.
Yeah, this is going to be a very interesting rest of 2020 on activities and events, and it's already been a unique one with no March Madness and no Masters, and the Kentucky Derby being canceled. So
and the Strawberry Festival.
Yeah, I'm afraid, and the Strawberry Festival. So it'll be interesting on what happens the second half of the year, and it all depends on how well behaved we are in the next 6 to 8 weeks.
It will, and I think that a couple of things to note is we did mention today that this is not going to be over. It will be something that will stay, and it will be something that will be here for us to have to combat, whether it's eventually by some type of a vaccination, or it's through continuing these type of practices that we're learning and we're trying to do. But one thing I think that we stressed in this last meeting that we were in that we probably need to talk about is the vulnerable population, which is our elderly and then our high risk. So most of the time people think, oh, well, let's just not let them out, which keeping my mother in is not the easiest thing to do. But she might not have gone anywhere before, but now that you're telling her she can't, she's really dying to go somewhere. So. But in that, you wanted to address that and something that the doctor mentioned when we were in our meeting.
Yeah, it doesn't take but just a few minutes to be in contact with someone who's positive for you to through that fluid transmission obtain that virus. And we're really asking seniors, the seniors and those with health conditions that are very vulnerable. This is something that's going to go on for 3 to 4, 5, maybe 6 more months very easily. So we're really stressing, please, I know that you want to take the grandkids to see the grandparents, and you want to go see the grandparents and sit have time with them, but this is a serious health matter that could be a life and death decision. Trying to stay away from them for a few more weeks, making sure everybody's healthy before you just pop in and say hello and spend time with them. That group is the group that is the most vulnerable and has the highest risk of death. So we want to protect them and stay away. And they're the ones that want to go. Well, we want to go to church, in a few weeks, and want to get out and want to go socialize and visit and all. But we really need to be mindful and again encourage them to stay home. And one of the great things is in our community, Portland is a great example of that, of people going and checking on their neighbors and going to the grocery store for their neighbor and taking care of things around the house for them so they can stay protected. So we that's one of the wonderful things as a result of this is I think we've become more neighborly than we have in the past. And it's in what is it? Ken Winder said, sit on the front porch and watch 2020 go by. Well, that's I thought that was a pretty good analogy there for the rest of 2020. But spend time helping out the elders around our community.
Well, I do, and we are really good about that. And the other thing is, this has made us all slow down, so it allows us a little more time to stop and to take a breath and to be able to be more kind and to help those people, because typically we're running in a fast pace and maybe we miss some of the things that we should. But I think that this is a great time for us to reflect, and I know that we're all ready to get out, so I don't discredit that. But somebody asked about the nursing homes that were hit hard. I know the health department looks at the report clusters. Are there any nursing, and 2 or more, are there any that have 1, and how are we working with the state to report those cases? I think the numbers are supposed to come out to report how many, not necessarily just more than 2 today or tomorrow, right?
Right. We've kept a tight eye on those locations, and we've done well. Some of them are out of their 14-day window, and we feel comfortable about those. But the bad thing, this thing could pop up at any time. So we're still monitoring every nursing home, elderly care facility, and keeping a tight eye on that. And again, they're going to need to stay somewhat quarantined for a few more weeks at least, just to protect that population.
Well, I do know, like I say, you guys have been working nonstop to get this, under control, to be able to get reports in. And a lot of it's out of your control. You do what you can, but there's always another step. Somebody else has something to do after you administer the test. So, and that's stressful for you guys. But then once you get the results, there's a lot of reporting to do. After that, you got to call the person and let them know if they're positive or if they're negative. And so that's a lot on you guys.
Yeah, starting this morning, we had over 1,000 phone calls to make. In my 3 clinics, I had somewhere around 22 staff calling those 1,000 individuals to report them the test results. And one of the great things, you love to hear that on the other end when they say, "Oh, thank you," when you say, "Oh, your test results are negative."
Right.
So that's a good thing. We like that. So, but again, it's one of the great things about public health is we love to be the bearers of good news, and we want to continue to do that in the next weeks to come.
Well, and again, 1,000 phone calls is a lot to undertake. So sometimes people may think that they've taken a little bit longer to get their test results back. When your test results may be back, it's just, again, making 1,000 phone calls is not something you can do real quick.
Yeah, it's been an undertaking, and a lot of individuals. I'm just tickled. My staff has stepped up. We've done a great job. They've put on their hard hats every day and come to work. And I've heard very little complaining, very little whining, or so, because it's what we do. It's part of public health, and I couldn't be more proud of my team in Sumner County.
Well, and I think that one thing that we need to note is you performed over 1,000 tests in 2 days in Sumner County, which is about a third of what you had done over these past several time frames. Is that correct?
Yeah, we've had quite a few numbers. People are once the restrictions were removed, we're doing over 125 yesterday, and my numbers today look like about that many today. So a lot of individuals out there interested in getting their test result back. Again, if you come out and you're negative, doesn't mean you can run around the world now, because you could. If you cross that individual somewhere that's positive, you could be coming back in 7 to 10 days and getting checked again, and you would get the bad phone call.
Well, and they have to realize that is negative from the day you had the test.
Correct.
I mean, it's not negative forever, like you say, or it's not, negative for the next 2 weeks. It is only from the time that you had the test. So we still have to follow the guidelines, and we still need to be smart. Somebody has a final question here. Is there anything that the Sumner County Health Department needs, and how can we help you? How can the community, the chamber, the city, how can we help you guys?
Well, stay home, keep a mask on, wash your hands, encourage others to stay home, stay healthy, and soon we'll get through this.
Well, we do appreciate you. And if there are needs that you have, let us know. The community is really ready to rally around and help. And you know that Portland and Sumner County is just great about that. So anything that we can do to help even your staff, even the little things, like you say, just bringing some snacks or bringing lunch. I know that is appreciated with them because they may not get the time to actually go have lunch.
Oh, that's true. That's one of the things. We've eaten well in the last 3 or 4 weeks, and that's all by the kind-hearted people in Sumner County and our communities coming by and visiting and dropping off food and thank you cards. And I stole an idea from Rutherford County, and all 3 of the clinics in Sumner County have signs posted on it that said "Public Health Superheroes Work Here." They're all posted out front. My staff, are just appreciative of that, and they are. I've got 56 superheroes that work at the health departments, and I'm proud of all of them.
Well, you do a great job running the health department and keeping them all on task, and again wrangling 3 clinics at the same time, and even now having pop-up clinics on Sunday. So you're going to continue to do that too this coming Sunday as well. You'll have the drive-through.
We'll continue for this week and all next week, 9 to 3 at all 3 clinics, and then tentatively set for Sunday, May the 3rd, back at Gallatin High School, 9 to noon. And we're going to be ready. I kind of told the staff, and I told the regional director, I said, we're going to run people through, and then run them through again, because I want to bust 1,000 in 3 hours. See if we can do that. So we'll have National Guard help, plenty of staff. The second time, our learning curve for the first time, we'll be able to really cut down the wait time and get people in and out.
Did you have a lot of people waiting in line after, or did you shut down, or did you service everybody that was waiting in line?
Everybody that's in line at 12 o'clock got tested.
Okay.
They were tested. Now, there was a little bit of a wait, but the majority, 99% of the people said, I've got nowhere to be. I can sit and read a book, sit here in the car, sit and spend time with the kids. We're playing games in the cars, and very, very few grumbles and gripes, and a lot of thank yous and appreciative smiles.
Well, the car's a little different atmosphere than being stuck in the house. So maybe it was just a little bit of scenery.
To get out of the house with it.
That's right. That's right. So one last question. How many actual testing kits do you have? So, and PPE, where are you on your PPE and all your testing kits?
We're in real good shape with PPE. We've been very efficient with our PPE, our testing kits. We've got plenty. We've been restocked with through the state. We should have plenty to take care of us for the duration.
All right. Well, we do appreciate you, and hopefully we can continue these talks. This is something that has come up since all of this, since we can't do a lot of face-to-face. So we're going to hopefully, once we get out and about, we'll hopefully have these once or twice a week with different people, and we'll have you back when we're not in the middle of a pandemic and we're actually able to talk about the job that you've probably forgotten that you have to do on top of all of this, because you kind of forget, because this is all the focus.
Great. Good. I look forward to this. Thank you, Sherry.
And also, let's let everybody know, number one, make sure you comment, because if you comment, you'll go in to win 2 tickets to Delaney Street Eats. And a shirt from our 37148 Spread the Local Love. But keep on looking out for how we are going to open, because in the opening, we are trying to do that on a phased, and we want you to be smart. So watch all the guidelines that come out and try to do the things that we're recommending. Some of them will not be mandated, but they're just smart things to do. So just be mindful and watch out for those. We'll be posting those at the chamber and get all of the information. Hal's going to do good about sending us the recommendations from him as well, because he wants to have less people coming in than this. He's got the one job where not seeing you is a good thing.
Yeah, if nothing bad happens, we've done our job.
That's right. That's right. Thank you, Hal, and we look forward to talking to you again soon.
Thank you.